Good afternoon. My name is Joaquin Machado. I'm the Director of Nursing here at Serenity Oaks Wellness Center in Fort Lauderdale. And today we will talk about infection control, the risk of infection in our workplace. Because we handle patients, clients that are coming from different environments. We don't know most of the time if they can be carriers of infections. We have to follow rules and regulations that protect ourselves, our coworkers, and also other patients in our facility. This is the same that we see in all healthcare settings. And of course, when we talk about infections, who is at more risk to be contaminated? The healthcare professionals, because we handle patients. And the rule number one we have to follow is we treat every patient as a source of infection because we don't know. Why we don't know? Because most of the time the patient doesn't know either. If we already know that patient has HIV, Hep C, Hep B, if the patient has a flu, we already have the knowledge how to protect ourselves. But what about the patient that has an infection and we don't take precautions? The employees that are more at risk to get infected are healthcare workers. And when I say healthcare workers, from housekeeping all the way up to nurses, doctors, surgeons, everybody who handles patients. There are two types of infections in healthcare that we have to recognize. The one that we call nosocomial infection, because it's the one that the patient acquires inside the facility, inside the healthcare setting. And the one that we call community infection, the one that the client, the patient, comes with at the moment of admission. Both we have, as a healthcare worker, is our duty to protect ourselves, protect our other patients, and our coworkers from both sources of infections. And now you can ask, how can it be possible that in a healthcare setting we can have this microorganism? Very simple. When we don't follow the rules and regulations, basically from OSHA, regarding rules of hygiene, cleaning, sterilization, we will create in our healthcare environment a good culture where this microorganism will grow up. And we will see now that these microorganisms, that they grow up in the healthcare environment, have a characteristic that make them more dangerous and more aggressive. Why? There are some microorganisms that they are already developed resistance to the antibiotics. And I know that all of you have heard about MRSA. Methicillin-resistant Staphylococcus aureus. But MRSA is not the only one. You see, vancomycin-resistant enterococci. Carbapenem-resistant enterobacteria. How these microorganisms at the end have developed these resistances? Because we think those microorganisms, they mutate to defend themselves from the antibiotics, and in the healthcare settings, in hospital facilities, those microorganisms are in contact and in constant mutation, and all the antibiotics that we handle with patients. So at the end, we have now these microorganisms that can be seen in the community environment. It is important for us to know when we have a client coming to our facility carrying one of these microorganisms, because we have to handle it with care to avoid dissemination of infection. And you know that MRSA can be in the nasal cavities of people, that they are carriers, but they can infect, they can spread the bacteria. People who have lesions in the skin that can have MRSA infections. So it is important for us, when the patient comes, the practitioner will conduct the health assessment and determine if there is a risk for that patient or client to have some of these infections, according to what? To the clinical features that the patient presents and the physical exam. Unfortunately for us, these microbes, they can survive in the environment, so they don't die if they are away from the human body. And you see, for example, the Clostridium difficile, the spore, which is the one that will develop the microorganism, can survive around a year in the environment. The MRSA, from 7 days to 7 months in the environment. So how important is for us to maintain our environment clean and follow the regulations for the safety environment that we saw when we talk about OSHA. When we say sources of infection, from where the infection can be gathered, the endogenous flora inside us, we have microorganisms that they are not pathogenic, they don't damage us, unless our immune system gets depressed and they get opportunistic. This is one source of microorganisms that can affect us when they become pathogenic. Usually they are not pathogenic. And human sources, staff, patient, visitors, whoever is in contact with us. There are indirect sources of infection. Equipment, surfaces, everything that is in our environment that can be not clean enough and become a culture for infections. Now, in infection control, we have to take care of this triangle. If we know the components of the triangle, we know how to break it. Agent, which is the microorganism, host, which is us, and environment. When we talk about infection control, we talk about how to break the relationship in between the three components. What do I do to break the relationship in between agent, host, and environment? Number one, we have to know the possibilities to have the agent present in the environment. Number two, we will follow OSHA regulations to control infections in the environment. And number three, we educate the host to avoid violation of the safety regulations that may put us at risk to be in contact with the agent, and we educate us to take care of the environment in the way that the environment will not become a culture for the microorganisms. There are plans that we develop in every facility for infection control. In every facility, there is an infection control officer that controls the process, but everybody is responsible to follow the regulations, from doctors all the way to housekeeping. Wearing gloves is the most frequent. Hand washing, the most frequent. Cleaning environment. Taking care of everything that may produce a source of infection. A patient can vomit. Patient can urinate in the floor. Blood. And the precautions are coming from the precautions the housekeeping will take when cleaning around the patients to the precautions we, as a professionals, will take when we are close to that patient. What are the three sources of infection? Blood-borne pathogen, I have to get in contact with the blood of the patient. Airborne pathogen, they travel through the air. So when we talk, when we sniff, when we cough, project the microorganism, and we, the people who are around, can catch it. And of course, the physical contact with patients that are infected, basically para-infectious, skin infections, skin parasites, that we need that physical contact with the patient to get infected. Okay, questions?
Okay. Question.
Yes.
You mentioned MRSA earlier, right? And somebody had MRSA. They say I'm driving and they sneeze on. Can I get MRSA?
MRSA is not considered an airborne pathogen. Okay. However, yes, it can travel. Remember, how long MRSA will survive in the environment?
A year. Up to a year.
7 months. So if I'm close to you, my nose is infected, and we are, I sneeze or cough, or even I'm handling a patient who has a wound and I am infected, yes, I can infect the patient.
I'm never leaving my house again. Like, you know, behind you, I'm driving, I'm sitting there.
Any other question?
What are some signs of MRSA? Is there a sign? Because I heard that you can catch it in the hospital. I heard MRSA, but is there any physical sign that I can look for?
I mean, in a patient who has MRSA because has a wound, well, the wound will show signs of infection, drainage, and etc.
So MRSA usually shows a wound.
But
Well, you may not see it if they have.
we can have, like I say, in the nasal cavity,
Right, it could be a wound inside. Of it, you know.
MRSA for people who are carriers of the microorganism, and there is not any specific sign that you can see of that.
Just sneeze in their hand and shake your hand. Well, you only go obtain it through inside. If they touch you, they can touch you and shake your hand, can you get it like that?
Well, if you have a lesion in your hand, yes, you can have it. But if then after you shake the hand, you do this or this, the mucous, sometimes they have minimal scratches or something. That's why you see how frequent we use the hand sanitizers. Okay, more questions? Thank you.